7 News at 10 starts now.
Good evening. Glad you're with us tonight. COVID-19 cases are falling in South Carolina, but the threat is still real. 7 News reporter Ann Maxwell has more on the trends across the state and the upstate.
A doctor at Prisma Health tells me cases have gone down since the big spike around Memorial Day and the 4th of July, but he says we shouldn't get complacent. Data from South Carolina state health officials show cases of COVID-19 declining from a spike earlier this summer.
I think they're going down across the state because people have taken the responsibility to put masks on.
Dr. Wendell James of Prisma Health says cities and big box stores mandating masks have been a big help. While testing has also gone down across the state, Dr. James says that's a sign of a slower spread. The percentage of positive tests also appears to be trending downward.
I think what you're seeing with decreased testing is we've mitigated the spread of this, and we're not seeing the rapid rise in cases in the community that we were seeing before.
Greenville was the first city and countywide hotspot identified in the state in early June, seeing a rapid spike in cases after Memorial Day. Dr. James says hospitals were getting concerned about being overwhelmed, but after a public push to get the virus under control, cases are down roughly 30% to a level that healthcare systems can manage.
What we said at that time was if we put the mask on, we distance, we take meticulous hand hygiene seriously, and if you're sick, you don't go to work, you get tested. What we said we would see is exactly what has happened.
He says cases are still significantly higher than they were before the spikes from Memorial Day and the 4th of July, and they could get worse again with Labor Day and the start of school. Greenville County Councilman Ennis Fant, who represents the hard-hit western part of the county, says he's worried too.
Now you see the numbers improving, and then we have a holiday, and everybody wants to go to the lake, to the beach, have their one little last hurrah before the fall and winter hits, and I'm afraid coupling that with the flu, we can have an explosion of the pandemic all over again.
Flu season approaching is another reason Dr. James says we need to continue to take COVID-19 seriously, as well as the flu, because getting the flu and coronavirus at the same time can make you sicker and lead to more strain on hospitals.
What we want is flu vaccinations, lots of flu vaccinations.
The CDC recommends getting flu shots in September and October. In Greenville, Ann Maxwell, 7 News.